Hello and welcome to Thursday's edition of COVID-19. I'm Min San-hee. Here in Korea, authorities have recorded fewer than 20 new infections today, with domestic cases hovering below 10. Officials nonetheless are calling for continued caution as cases worldwide, including those that is in the US, show no sign of abating. We start our program now with more on the numbers on the pandemic with our Kwon Soar and related news with our Hong Yu. So do start us off with the local updates for this Thursday.
Sure, Sunny. Well, it looks like the numbers today are much more relieving than yesterday because we have lower infections here locally as well as lower infections that came from abroad, as we have local infections in the single digits and imported cases dropped to 11, although with that still in the double digits for the 35th straight day. And with that, we have 18 new cases this Thursday, raising the total to 14,269. The death toll remains at 300 since the past couple of days, and we have 45 less people in quarantine and 63 new recoveries, raising that total to 13,132. Now, it's the first time in 38 days that we have cases dropping to the teens, and it's quite a plunge compared to yesterday. 30 less cases than yesterday, while the average, we had fluctuations between the 20s and the 60s, although of course over the weekend we had that one-day surge to the three-digit numbers. Now let's move over to our map now. We have five new cases, that is in Gyeonggi-do province, and 3 in the capital Seoul, and 1 case each in Gyeongsang-Buk-do and Gyeongsang-Namdo provinces, and 8 were confirmed at the nation's airport or seaports, while we have 3 cases, 3 imported cases that were detected locally, and those were 1 in Gyeonggi-do province and 1 in Gyeongsang-Buk-do and 1 in Gyeongsang-Namdo province each. Now, while the situation here in Korea seems to be somewhat stabilizing, that is not the case abroad. So let's take a look here. We have over 292,000 new cases in the span of 24 hours, raising the total to almost 17.2 million. We have a total of 670,200 fatalities and some 10.7 million recoveries. Let's move over to the places which were hit hardest. Let's take a look at Brazil here. At some 2.5 million cases, it has also surpassed the 90,000 mark when it comes to fatalities. And also South Africa had some 11,000 new cases, raising the total to over 471,000. Let's take a look at other places. Peru has now over 400,000 cases now, and also Iran looks to be soon having more than 300,000 cases with some 16,300 fatalities. And those are the updates I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so I'll see you back at the desk. We turn now to the situation across the border. More people in North Korea have been tested for COVID-19, and while Pyongyang has yet to confirm its first case, it appears that it is going out of its way to contain an outbreak. I have our North Korean affairs correspondent Hong Yu here in the studio with me today. Good to see you again, Yu.
Thank you for having me.
Now, Yu, let's begin with the tests for the virus in North Korea then.
Yes, honey. The WHO said Wednesday that a total of 1,211 people have been tested for COVID-19 in North Korea as of July 16th, and they have all tested negative. Edwin Salvador, the representative of WHO office in Pyongyang, said that currently 696 North Koreans are under quarantine. These are people that handle cargo coming into Nampo, North Korea's largest port, and the border city of Siniju. He added that the North's border still remains closed, but it is allowing the movement of aid shipments such as vaccines and medical supplies needed to contain COVID-19. The WHO is sharing its COVID-19 guidelines with the regime's health authorities and modifying it to accommodate North Korea's situation. At the moment, they are classifying people showing symptoms of the virus into 3 different groups. They include those being tested, traced, and treated under isolation, in which suspected patients are being quarantined at designated rural or military hospitals.
Now, Yu, I understand there are concerns over supplies of test kits in North Korea. How are officials there managing that situation?
The recent increase of testing is due to the regime's strengthened monitoring amid the recent uptick of cases in China. Plus, with a new cluster infection being reported in the Chinese port city of Dalian, North Korea is intensely monitoring its border areas near China. North Korea has a total of 15 laboratories designated to test COVID-19. The WHO says primers and probes for machines used to test COVID-19 have arrived to facilitate 1,000 test kits sent from its Southeast Asia regional office. UNICEF is also sending medical equipment needed for their project in North Korea on mitigating the impact of the COVID-19 pandemic on tuberculosis and malaria. The UN Security Council Sanctions Committee on North Korea announced on Wednesday that it granted a sanctions waiver for such aid by UNICEF last Friday. The equipment includes respirators and cardiopulmonary resuscitation tools worth more than $750,000. A one-year waiver has been granted to those supplies bound for North Korea, 6 months longer than the usual exemption. Transporting goods has become difficult due to COVID-19.
Right. Now, North Korean leader has reportedly called for a maximum emergency alert this past Saturday, claiming that an ex-defector who had returned from South Korea was showing signs of COVID-19. Do you have any updates on this story?
Yes, actually, Sunny, North Korea's second leader in command, Choi Ryong-hae, has conducted an emergency virus inspection of Kaesong, the city where a defector from South Korea, reportedly with symptoms of COVID-19, had returned to on July 19th. The North State-run Korean Central News Agency reported today that Choi inspected virus prevention efforts in the city that has been on lockdown since last Friday. He ordered local officials to make sure food and medical supplies are provided to residents and that strict containment measures are in place. Everyone who have been to Kaesong are being isolated and monitored for symptoms of COVID-19. North Korea's state-run newspaper 노동신문 published photos of medical personnel on the streets wearing protective gear, taking temperatures from drivers, and sterilizing cars. Pyongyang's Health Minister Oh Chun-bok said at the Emergency Politburo meeting of the Workers' Party on Saturday that the North was at risk of witnessing an outbreak stemming from the ex-defector with COVID-19 symptoms. Nevertheless, South Korea's new Minister of Unification Lee In-young said he hopes to cooperate with North Korea in containing COVID-19. Let's take a listen.
I'm aware that the situation in Kaesong is pretty serious, and I'm concerned about the livelihoods and the health of its residents. If we have the chance, we want to cooperate with North Korea in containing COVID-19. We are taking into account various scenarios and coming up with appropriate measures.
For the first time since the defector allegedly showing symptoms returned to North Korea from the south, 노동신문 reported today that they have 0 confirmed cases. Nonetheless, North Korea has ordered foreign diplomats in Pyongyang and workers at humanitarian organizations to stay in the capital city and not travel to other locations. Everyone is being required to wear face masks as well.
All right, thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular briefing on COVID-19 here in Korea. Now, as mentioned yesterday, the government briefings on the pandemic for the weekdays are to take place on Mondays, Tuesdays, Thursdays, and Fridays. There will be no briefing on Wednesdays starting this week. Now, as our soar reported, Korea recorded 18 new infections on this Thursday, with 11 of those cases coming from overseas. Accordingly, domestic infections are back below the double digits. Health authorities, however, believe the daily number of cases, that is, will rise again in the coming days, as another group of Korean nationals from Iraq is scheduled to return home this week. And on a more somber note, 3 Vietnamese individuals who fled from a self-quarantine facility in Gimpo, Gyeonggi Province on Monday have been caught and are to be deported and banned from re-entering Korea. Now, this is reportedly the second case of a quarantine breach in a week, following that by a Korean American while in quarantine in Incheon. In response to these violations, the authorities have agreed to strengthen security situations at these quarantine centers. The briefing has started. We'll come back to you afterwards.
네. Let us now begin our regular briefing for July 30th, Thursday, on the COVID-19 situation here in South Korea. As of today midnight, we have a total of 7 new local infections and 11 new imported cases. And the total number of confirmed cases now stands at 14,269. 63 more people have been discharged following full recovery, and a total of 837 people are in quarantine undergoing treatment. The number of patients with critical conditions stands at 13, and we had no additional fatality as of yesterday. Here are some major updates on the domestic transmissions. First, in the city of Seoul, at the Gangseogu, we have the Gangseogu Central Daycare Center, and we also have one person being confirmed, and a total of 29 people have been confirmed to date. And in relation to a group meeting at the Seoul City Songpagu district, we have one more case, and the total now raised to 8. And in relation to the Seoul City Hall case, all of the 166 people have been tested who are working at the same floor, and we are also conducting these testings and awaiting the results. And also, out of the visitors who visited the 11th floor, we had 180 people who wish to get tested, and the testing is currently undergoing. And in Gangwon-do province, in relation to an Hongcheon camping group, we have a family, a total of 18 people who are 6 family members. And 6 families, we have additional cases, and we are conducting our epidemiological investigation currently. And next, we have the progress on our updates for the North Korean defector who fled to the North Korea. And these are some information that is based on the data shared by the police agency. And we have 2 people who have been come into contact, and these 2 people have been tested. We have seen whether these people have been tested, and so far no data has been confirmed. In addition, yesterday we have been identified by the police agency a further list of the people who this person has come into contact, and during today we will be collecting the samples from them and have the testings being conducted. And here are some updates on our 11 new imported cases that have been reported. And at the points of entry, 8 people have been confirmed. And while on self-quarantine, 3 people have been reported as imported cases. Out of the 11 new cases, looking at their countries of departure, 2 from the US, and also 4 from the Philippines, 3 from Saudi Arabia. Starting from July 1st, we also have intensified our quarantine measures for the Russian flagged vessels that have docked in the ports here in South Korea. And out of the 259 ships that have departed Russia, we have conducted a number of on-site quarantine measures. And starting from today, we will be also intensifying the quarantine measures also for these vessels that have departed the 6 countries that are in the high-risk countries. And also we will be conducting our quarantine measures, the port intensified quarantine measures, which mandate all of the testings of the sailors as well to get tested as well. And they will also be applied to these 6 countries of high risks. And next we have some updates on the R&D procedures. The KCDC going forward, we have been we will be carrying out starting from tomorrow 3 p.m. a global trend of the vaccines for COVID-19, and these forum will be carried out tomorrow, and we will be looking at the development trends of the vaccines by platform on a global level, and we will also look at the trends of negotiations and also
코로나19
imports of
혈장
these
치료제
vaccinations
개발과
going forward.
관련해서는
And in regarding the
이제까지
blood
총
plasma treatment,
1,098명의 완치자께서
about
참여 의사를 밝혀주셔서
1,090
실제로
people have expressed their intentions, and about more than 700 of them have successfully donated their samples. And once again, we would like to thank all of the people for their dedications and their donations as well.
혈장 치료제와는
The
달리
plasma
별개로
treatment, and aside from the blood plasma treatment, we also are looking at the recovery plasma samples that have been collected from these cases, and they have been successfully administered to critical patients with critical conditions. And next, we have some updates on the reported cases for our safety e-report, and all of these cases, a majority of them were reports on the breaches of not wearing the masks. Especially, we have conducted and we have been sent of the reports that many people who are working at these many people they did not wear face masks, also at the construction sites as well, and also fortune tellers they did not wear these face masks as well. And there were also cases where the fitness centers they did not wear face masks properly, and they only cover their mouth instead of covering the mouth and their nose as well. So these are some cases that have been reported via our safety e-reports application. And please remember that your face mask prevents your droplets from infecting others, and it also protects yourself from the droplets that is emitted from others. If you are at indoors, in which keeping a 2-meter distance is difficult, you need to wear your face masks at all times. And even if you are outdoors, you need to wear face masks if you cannot keep such a healthy distance with others. And properly wearing this mask means that you are covering your both nose and mouth, and you shall not touch the surfaces on a frequent basis, and also wash your hands on a regular basis after touching the face masks. And ahead of the upcoming summer holidays, we have mentioned that we have seen 6 cases in relation to a camping group in Gangwon-do Hongcheon. And we are also concerned of possible further risks of infection during the summer holidays. So we ask you to always abide by our quarantine measures if you are going on holidays. So please remember, we have 3 do's and 3 don'ts. 3 do's include wear your face mask at all times if you are indoors, and minimize your stay at rest areas or restaurants, and also keep 2 meters of healthy distance with others. And here are also 3 don'ts that you need to also remember, and they are as follows. If you have symptoms of fever or respiratory symptoms, please do not go on a vacation, and please do not go to closed and crowded and close contact environment, especially at hours of crowdedness, and also avoid doing activities that increase the risks of droplet infection. And even at this very moment, we also, in our country, there are many damages and losses that are carrying out and resulting from the heavy rainfall. And during this weather, we are also prone to diseases like the waterborne infectious diseases. So please ask yourself, and we also ask yourself to keep and maintain personal hygiene, and you need to always wash your hands on a regular basis, and please wear your rain boots or rain gloves as well when you are outdoors, and also be careful of what you eat. Please eat healthy food as well. And we also have some last messages for the COVID-19. The COVID-19 is threatening the global society as a whole. And looking at the major advanced countries, many countries have conducted the lockdowns, and they are now easing their
lockdowns and now seeing a resurgence of the COVID-19, and they are seeing the situation aggravated, especially during the summer holidays. Spain, in other coastal countries in Europe, they are also seeing easing of social distancing as well as quarantine measures. So they are seeing another resurge of the outbreak. So in Europe, many quarantine authorities are mulling over whether they need to have another intensified round of social distancing. And we shall not also stay complacent. And this is sending us a great word of warning. And as we mentioned earlier, we have told you about the camping site where it led to local infections, and we also have other possible infections. And if you are at outdoors, even if you are at outdoors at camping sites and beaches, even though that you are outdoors, you will also be prone to the COVID-19 infection if you cannot keep healthy distance with others. So we ask you multiple times. We ask to also go on your holidays in minimum groups of people, just with your family members is highly recommended. And please do not move and do not enjoy your vacation in crowds and in large groups, and also do not go to group dinings as well, as this can increase the risks of COVID-19. And as we mentioned, the 3 Gs that we mentioned before, the wearing a face mask and keeping healthy distance while washing our hands is also very important. And we also ask you to remember the 3 don'ts also, which are very important, and refrain from closed, crowded, and close contact environments. And if we cannot keep our quarantine measures during the summer holidays, we believe that we will have a repetition of the Itaewon Club case, which led to a massive outbreak and which also led to a large social loss, including the shutdown of businesses and schools and so forth. And as for vaccine development as well, we would like to comment that the entire community is exerting its full efforts to develop a COVID-19 vaccine, and they are also having a vaccine race in order to ensure access to these vaccines. However, we believe that development of the vaccine is something that needs to be carried out under full consideration. Here in the country, in South Korea, we also are exerting our full efforts to develop an effective vaccine. However, development of a vaccine is not like a 100-meter sprint. Rather, we need to be based on evidence of scientific evidence as well as public trust, and it needs to be verified, and it also needs to be safe. And we are currently preparing such vaccines under such principles. And until we have an effective vaccine or treatment against COVID-19, we believe that you need to continue to exert your full efforts to comply with the quarantine measures going forward, and especially during August, when we are to enjoy our summer holidays, we need to also exert our full efforts to maintain your quarantine measures, including wearing a face mask and distancing. Thank you very much.
Right, that was Kwon Junuk, the Vice Head of KCDC, with Thursday's afternoon briefing. So I hear he's touched upon the defector who went back to North Korea.
Right, we're talking about the North Korean defector who returned to the North and who was suspected of having COVID-19 symptoms, according to North Korean reports. So it looks like the government has received another list of people who had contact with this person, this defector, as earlier they had 2 people who had frequent contact with this 24-year-old man, and they tested negative for the coronavirus, and they seem to be in self-isolation right now. So it looks like the other people are going to be tested for COVID-19 today. And as for the imported cases today, we had 11 of those. 4 were from the Philippines, 3 from Saudi Arabia, 2 from the US, and 1 from Iraq and Uzbekistan each. Now, as we're just around the corner of the summer vacation, Kwon Junuk, the Vice Director of the KCDC, again stressed stressed the 3 do's and 3 don'ts that should be abided by during the vacation. The 3 do's being wearing face masks whenever you can, minimizing your stay at rest areas and restaurants, and also keeping 2-meter distance with other people. And the 3 don'ts are, if you have symptoms, don't go on vacation, and stay away from closed and crowded places, especially during the busy hours. And the last one being avoiding activities that increase transmissions of droplets.
All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
In other related news, movie theaters here in Korea are starting to see a growing number of visitors as a few local productions lure them back to the big screen. What's more, the interest comes amid limited capacity at the theaters and other social distancing measures. Do take a look.
Moviegoers are streaming into a multiplex cinema in Seoul to watch a new film release.
영화 반도가 개봉을 해가지고 재밌을 것 같아서 보러 왔어요. 보니까 강철비가 좀 재밌을 것 같아서 일단 강철비 생각하고 있습니다.
Cinemas have seen a sharp decline in ticket sales due to COVID-19, but it now appears the worst is behind them. Blockbuster films are being released, and movie lovers are flocking to the silver screens once again.
Due to the outbreak of COVID-19, there has been comparatively less number of new releases in the market. But after the recent premiere of the movie Peninsula and Steel Rain 2, it seems like people are showing more interest towards movies and coming to theaters.
Movie theaters had taken a direct hit with the outbreak of COVID-19. Following reports of a COVID-19 patient who had visited a theater back in January, cinemas nationwide quickly became all but deserted. In the first half of 2019, over 100 million movie tickets were sold, but those figures tumbled by nearly 70% so far this year, with only 32 million theater admissions.
학교가 개학한 이후인 4월 달은 관객들이 꽤 많이 있어야 함에도 불구하고 올 4월 달 같은 경우는 최하 2004년도 이후로 가장 적은 관객을 기록하는 등 어떻게 보면은 뭐 영화 산업 자체가 폭망했다고 할까요? 굉장히 큰 문제가 있었다고 해야겠죠.
With the arrival of summer, the film industry began showing signs of emerging from its deep slumber, beginning in the month of June. Citizens are now visiting movie theaters once again, a sign of faith in the Korean government's ability to contain the virus.
안전하게 많은 분들이 이런 대중문화에 다시 한번 활성화를 할 수 있는 시작이 됐으면 좋겠다라는 생각을 합니다.
A pair of big-budget Korean zombie flicks, #Alive, and Peninsula, helped revitalize the local film industry.
한국과 동시기에 개봉한 아시아 주요 국가들, 대만, 싱가포르, 말레이시아, 베트남, 태국 등에서는 개봉과 동시에 오프닝 기록을 경신하면서 이제 박스오피스 1위를 유지하고 있고요. 좀비들을 시원하게 쓸어버리는 카체이싱이 마치 코로나19 바이러스를 물리치는 듯한 그런 대리만족을 선사한다는 평을 받고 있습니다.
With the COVID-19 pandemic continuing to rage on, cinemas are taking strict disease prevention measures to ensure a steady stream of visitors during the summer blockbuster season. The release of many Hollywood blockbusters have been delayed, opening the door for local films to dominate Korean cinemas in the second half of 2020.
이미 초여름 들어서 반도와 같이 흥행력이 강한 작품이 개봉을 했고요. 강철비 2나 다만 악에서 구하소서 같은 작품들의 개봉이 이어질 것이기 때문에 하반기 들어서는 좋은 한국 작품들을 많이 만나는 그리고 관객들이 극장을 찾는 그렇게 되리라고 예상을 해봅니다.
With strict preventive measures in place, moviegoers in Korea are rediscovering the joy and magic of cinema.
Hong Kong, meanwhile, is battling a fresh wave of COVID-19. The city has been recording over 100 new cases daily for more than a week now. I have Newton Wan, a pilot and resident of Hong Kong, live on the line with more. Hello, Newton.
Hello, Sunny. How are you doing?
Fine, Newton. Now, less than a month ago, Hong Kong was noting an average of under 10 daily infections, but now that number stands at above 100. What appears to be fueling the resurgence, and how severe is the latest situation there?
Actually, prior to the third wave, as we call it here, there were 21 days of no local infections. The 10 that you mentioned were all imported from people flying in, but they were caught at the airport during their required mandatory COVID testing. The reason why the third wave began was a category of people were exempted, which is basically mostly sea crew and air crew. Since lockdown in February, approximately 50,000 exempted sea and air crew, mostly, have been able to enter Hong Kong and not require any form of quarantine, which is standard for passengers. For the first 4 months, this was a system that worked. In the last month, unfortunately, it has led to a community spread that is much more severe than the first outbreak starting in Wuhan and also the second outbreak in March, April. Up until June, there were only 1,200 infections, 5 months, basically none. In the last month, it has gone from 1,200 to 3,000 with 1,400 active cases. The exemption has been closed as of July 8th, so that's about 3 weeks ago. The Hong Kong government requires air and sea crew to go through COVID-19 testing at the airport. So that loophole has stopped, and unfortunately, community spread has already begun. We do hope that it will get under control fairly quickly. Now, I just want to emphasize, for a 7.4 million person city, 3,000 infections is very little. On a per million case basis, I'll just give a few countries as comparison. The United States has 13,600 cases per million. Singapore, a city that's most commonly compared to Hong Kong, has about 9,000. Hong Kong stands at 400 per million, and in South Korea, it's 275 persons per million. So both Hong Kong government and the Hong Kong people have been very successful, globally speaking, at fighting COVID.
Right. Now, in response to this troubling surge, I'm speaking about the surge that's happening right now. I understand authorities there have put in place a number of tougher restrictions. Do tell us more about these restrictions, Newton.
Yes. As of yesterday, July 29th, Hong Kong has enacted their strictest measures to date. Gatherings in public are limited to 2 persons. Masks are mandatory, both indoor and outdoor public areas. People are not happy with these restrictions, of course, but in general, people understand. The government explains very well why they impose these restrictions. These severe restrictions are for 1 week only. The government hopes to relax it if the numbers come back down. Other venues that have been shut down as part of the current social distancing, businesses and places where it's impossible to do social distancing. Examples are nail salons, gyms, pools, spas, sports grounds. The biggest confusion right now with these new rules that were implemented with short notice is for smokers. In Hong Kong, there's currently a public ban for smoking indoors, and it's impossible to smoke with masks. So right now in Hong Kong, we're seeing a lot of people hiding behind trees and other areas to smoke outdoors, trying to avoid a fine. The fine is quite high right now. It's 25,000 Hong Kong dollars if you're caught. That's about $3,200 US if you're flouting social distancing guidelines. The 2 theme parks in Hong Kong have been shut, Disney and Ocean Park, shut since July 15th. These measures are in place till August 4th. We hope that the numbers will come down where they'll relax the measures. And the main change, other than the COVID test for sea and air crew, is the government is increasing its testing capacity so that they can do better contact tracing. Because right now, this is what's the problem. We don't know how the infections began. We know it came from overseas, but we don't know the chain of infections.
Now, Newton, like most other industries, that of airline has also been hard hit by the pandemic. You are a pilot by profession. How have you been faring, and how have those people in your industry been able to ensure their livelihoods amid the pandemic?
It is very difficult. I have personally been flying aircraft for 20 years, including helicopters and seaplanes in previous jobs. I worked 5 years in aviation education, teaching pilots to fly. In universities, 4 years in the airlines, and 9 years and now in private aviation. I've worked for companies all over the world, lived in 10 cities across 6 countries and territories. It's been very bad for Hong Kong, mainly because every flight is an international flight. With all the quarantine restrictions and every country having different rules, it is very difficult, and air travel has stopped in Hong Kong. For larger areas such as in Europe, USA, China, where you have a large domestic area, flights have largely recovered from the initial first and second waves in their countries, but it's definitely still down to pre-COVID levels. Aviation has never seen something like this. IATA, the International Air Transport Association, is predicting revenues to go down 50% this year. That's $314 billion in loss. It is very difficult for the governments of the world to provide enough financial support for all the airlines to make up for that $314 billion of lost revenue. In April, 70% of the world's airline jets were parked and not flying. So IATA and various industry projections say that the recovery to 2019 air traffic levels, they're expecting, on the optimistic case, 2 years, the least optimistic case, 6 years. It is very difficult, and we've already heard many stories of people in the aviation industry retraining to get jobs in other industries. So it's not a good picture right now.
Right. Well, our prayers are with you, Newton. Now, that's all the time we have for now. Thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much. Bye-bye.
The greatest threat we face now is not the virus itself. It's the lack of global solidarity and global leadership.
The importance of leadership during times of hardship has been underscored throughout history, and in recent days, the truth behind those words of wisdom is being put to test given the raging pandemic worldwide. For more on this, I have Professor Cho Hee-kyung from Hongik University here in the studio. Welcome to the program, Professor Cho.
It's good to be here.
And I also have Professor Yoo Hae-young from New York University. Welcome to the program, Professor Yoo.
Thanks for having me.
Professor Yoo, why is leadership considered to be even more important in guiding a country during times of an infectious outbreak?
So fighting for a pandemic like COVID-19 requires significant preparation, intervention, and coordination. Due to the nature, without the coordinated actions of, members of the society, it's really hard to contain the virus. If you think about the institution that can implement the coordination, that's the national government. That's why the political leaders that lead the national institutions really matters. I think that there are three factors that really matter in responding to COVID-19 crisis. First is a clear communication about the state of the virus, and second, early intervention like a lockdown, and third, reallocation of national resources such as sending material and human resources to the area that hit hardest by the virus. The quality of elected leaders affect all these three dimensions, and especially their words and actions have downstream consequences on citizens, and that's why these leaders really matter. We know that even in normal times, quality of elected matters, but you can think that their importance is magnified during the pandemic.
Right. And given this scenario, our president here, Moon Jae-in, has been garnering quite a bit of international acclaim for his handling or response to COVID-19. What aspects of his leadership, Professor Cho, has been highlighted?
I would actually focus on what he hasn't done rather than what he has done in terms of COVID-19 leadership, because as Professor Lee mentioned, three important things such as clear communication, early intervention, and reallocation of resources that didn't actually happen in the initial stages of our response to COVID-19 in Korea. We were actually quite slow off the mark in terms of responding to the outbreak. There were a lot of calls by expert groups to close the border, especially from travelers from China, for example. That didn't really happen until early April, although the first case was discovered back in January. There was also the debacle over the supply of face masks initially. You recall all those queues of people lining up to buy face masks and the unscrupulous price gouging, etc. So although he didn't really respond so well initially, what he did do well was to then defer to the experts. He didn't get in the way. He let the data and science do their work and listen to what the experts said. And he also didn't make the issue political. He didn't use it for his political advantage. And so for those things, I think he showed good leadership by refraining from things that he shouldn't do.
I see. So he gave the stage to the experts.
Exactly. Yes.
Okay. Professor Yu, Korea is also garnering quite a bit of attention for its relative success in handling COVID-19 compared to its counterparts worldwide. What is the reason perhaps behind this attention? And compared to those countries that have not been able to keep the contagion under control, what did Korea do differently? Or what is Korea doing differently?
So I was in New York until the end of May, the epicenter of, U.S., pandemic. So, for me, I have a, clear perspective and idea why Korea is considered, one of the success stories and why U.S. is considered, failure in terms of, responses. I think that there are three key differences when we especially compare South Korea and the U.S. The first difference is in national healthcare system. As you know well, in Korea, we have a single-payer healthcare system financed through the national insurance insurance cover, and that it covers most of the populations. And in the U.S., it's different. Depending on where you work, you have to buy and purchase insurances. So there's a lot of uncertainties, and 8.5% of the U.S. population, they don't have health insurance. So because you don't have health insurance, a lot of people in the U.S., they feel like barrier to access to healthcare is really high. So when the first case reported in the US, the message and emails that I got from my doctors and the school is basically stay at home and just, wait until you get really, your condition really serious. So that's very different from the Korea situation. In Korea, it's really easy to find the clinics if you feel uneasy, right? So that's the first thing. And also, if you look at the healthcare expenditure, Korea's healthcare expenditure per person is only 1/3 what U.S. citizens spend. Even though we spend less, there is, I think, a better access to healthcare. So that's the first difference. And second difference is that this is more institutional and fundamental. Think about the government structure. So U.S. is a federalism system. What does that mean? 50 states, they constitute a United States of America. So in the different state had a different degree of severity in terms of pandemic in their initial phase, right? So that means different governors reacted differently depending on their situation, and pandemic requires a lot of coordination across different states, but that didn't happen in the U.S. because federalism system. But the situation in Korea was very different. As you know, Korea has a very powerful central government. So that means when, for example, Daegu and the surrounding area declared as the national disaster center, central government quickly sent the personnel and material to that area so that we quickly reallocated the resources where we need them most. I think that also made a big difference. And finally, as Professor Joe said, I think the communication style that government adopted were very different. In the U.S., President Trump mostly led daily briefing at White House. But in Korea, we rarely see politicians or the president. Most of the daily briefings ran by the experts, senior bureaucrats who are actually responding to viruses. And also the way they communicated information that actually prevented the spread of misinformation. So I think that was a key difference between the South Korea and the U.S. in terms of their response in terms of pandemic.
And speaking about Korea's response to the pandemic, it's been quite favorable, of course. And staying with that, Professor Cho, what could Korea perhaps do to secure a stronger foothold, perhaps, in international affairs to ensure security and stability?
You mean post-pandemic era?
Yes, I do.
Okay, well, I've felt for a long time that we actually punch below our weight in the international arena. We joined the OECD more than 20 years ago. We've ranked, in the top dozen of the largest economies in the world for, more than 20 years. But compared to other middle powers such as maybe Canada or Australia, who normally punch above their weight, we are really just a small kind of piranhas in the international arena. And there is so much that we can actually offer, I think, given our developmental history, the fact that we have gone from a dictatorship to democracy in such a short space of time, and achieving the economic development as well. This is something that no other nation state actually has done in that kind of time frame. And so although we've got so much to offer, I think we have been up until now not very confident in ourselves and our ability to lead. And that's because possibly something to do with our past, particularly the colonial history that we've had, but also the fact that we were late starters in modernization and industrialization, and we were always looking to the so-called advanced nations and developed countries for answers. And so we are always playing follow and catch up, right? But COVID-19 has really shown us that those advanced nations don't have all the answers, that we have the ability to solve problems as well. And so I think going forward, we need to be more confident and more courageous about our own ability to lead, and also our own ability to solve problems and help others. And the other thing, as paradoxically as it may sound, is to actually bolster and foster our domestic market and our independence. Because if you are dependent for more than half of your trade on another neighbor, or your security on another nation, then you can't really show true leadership. And so we have to strengthen ourselves and at the same time become more confident and more outspoken on important issues.
I see, Professor Jo. I would love to continue the studio discussion, but unfortunately we are lacking time right now, so I'll have to end it there. Thank you very much for your thoughts, Professor Jo, and thank you very much, Professor, for being here with us today.
Thank you.
Right, well, that brings us to the end of this edition of COVID-19. Do tune in tomorrow as we address the safety precautions for the summer season amid the pandemic. In the meantime, do share your thoughts and inquiries with us through our social media accounts or homepage, arirang.com. Thank you for watching.